CPT JJ-CPB, Introduction, page 13, part 5.
Requests to update the CPT nomenclature.
Nomenclature, right?
Yes.
Requests to update the CPT nomenclature. Okay? The effectiveness of the CPT nomenclature depends on constant updating to reflect changes in the medical practice.
This can only be accomplished through the interest and timely suggestions of practicing physicians and other qualified healthcare professionals, specialty professional societies, state medical associations, organizations, agencies, individual users of the CPT code set, and other stakeholders.
Other stakeholders. Let's say a stakeholder is anybody who has an interest in the CPT code, right? So accordingly, the AMA, what's AMA?
American Medical Association.
The American Medical Association welcomes correspondence, letters, inquiries, questions, and suggestions and ideas concerning CPT coding and nomenclature for all and new procedures and services, as well as any matters relating to the CPT code set. All this theory part, it says that the AMA takes suggestions happily. Right? If you're in the medical field and you think that something should be corrected or added or any other changes, you can talk to them, to the AMA, okay? So CPT nomenclature used to report medical procedures and services performed by physicians.
CPT is a registered trademark of the American Medical Association.
And CPT means it's a trademark of the AMA or American Medical Association, okay? So that is our theory for today. Now we're going to do a problem. So ready, set, go. Okay, CPT JJ-RVA, page 255, exercise 55, and this is a level 1 exercise, and it reads like this.
Surgery, cardiovascular system. Patient is admitted with alcohol cirrhosis and has a TIPS procedure performed.
This is the surgery section of the CPT manual, is the cardiovascular system, and the patient is admitted with alcohol cirrhosis and has a TIPS procedure performed. Okay, that's the procedure. Now we're going to count to 3 so you can give us a CPT code for this procedure. 1, 2, 3. Okay, the answer is 37182. You got that? 37182. If you got it, congratulations. If you didn't get it, let's give you a couple of tips. Okay. First tip is what is TIPS?
It is short for transjugular intrahepatic portosystemic shunt.
Right. TIPS it's a big description of a procedure, but it stands for transjugular intrahepatic portosystemic shunt. Okay? Okay, the tip number 2.
A TIPS procedure is when the doctor inserts a catheter through your skin into a vein in your neck. So start looking in the index for insertion, then follow with shunt.
Right. So TIPS is just a shunt, right? And a TIPS procedure is when the doctor inserts this shunt or a catheter through your skin into a vein in your neck. So what are you going to look for in the index? First, insertion, because the doctor is inserting a shunt, and then shunt, and go from there, okay? And there's an extra information about TIPS. TIPS is a procedure.
It's a procedure that may be used to reduce portal hypertension.
Portal hypertension.
And its complications, especially variceal bleeding.
Variceal bleeding, right? Okay, so with these tips, you already have an idea of what are you looking for or how to go about it. And you know that the answer is 37182. So we're going to count to 3 so you can pause the video and give us the path to the answer, okay? So 1, 2, 3. Okay, this is the whole summary of the problem. This is a surgery section of the CPT code is the cardiovascular system. The patient is admitted with alcohol cirrhosis and has a TIPS procedure performed. There's only one code, and the code 1 through the index is found like this.
First you go to index.
Go to the index.
Then you go to insertion.
Go to insertion, because that's what the doctor is going to do. It's going to insert a shunt. And then you go to
Shunt.
Shunt. And then
Intrahepatic portosystemic.
you find intrahepatic portosystemic, which is the one we're looking for, that type of shunt that we're looking for. And the code that you find is
37182.
You're lucky that you found only one code. So all you have to do is just go to the tabular and check this code, right? So the code 1 through the tabular is found like this.
First you go to tabular.
Go to the tabular.
Then you go to this procedure, 37182.
Right. Go to the code that you found in the index. And what does it say?
Insertion of transvenous intrahepatic portosystemic shunt or shunts, and so goes on forth.
Yeah, it goes on in the description, but this is exactly what you need. This is exactly our problem. So that's why we have an equal sign at the end, which means we double check, right? Can you circle that? Yeah, there you go, the equal sign. And so the answer is 37182. Okay? Thanks for watching, and don't forget to visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
Right, just click in the subscribe button on the red rectangle, and then what do they get?
You will get up to 3 videos every day that we make. ICD-10s, CPTs, all that is needed to pass the medical coding certification exams.
That's correct. So don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.